Hello, we are from SGD 5 and we would like to present our student project for the special topic blocks entitled The Role of Yoga in Overcoming Sleep Disorders. We have 12 members in our SGD. There is Stevenus, Phoebe, Ananda, Ardisa, Amanda, Naomi, Mira, Angeline, Justin, Audrina, Kirana, and Bintang. And my name is Mira. I'm a Grace Richa with the last three digits 018. Today I will talk to you about the chapter 1 of our student project. So first of all, we're going to talk about sleep, whereas sleep is a natural state of mind and body characterized by a diminished state of consciousness, sensory activity, and muscle activity. Without adequate sleep, our body will lose its ability to create new memories, focus, concentrate, and respond. Inadequate sleep also affects the heart, lungs, metabolism, immune, and disease resistance. And chronic lack of sleep can increase our risk of having high blood pressure, cardiovascular diseases, diabetes, depression, and obesity. And therefore, it is a very important topic to talk about. There are several prevalences of sleep disorders. The first one is the prevalence of general sleep disorder, which is found in 32.1% of the population. And the prevalence of insufficient sleep is found in 43.2% of the population, and between 30 to 48% of adults struggle with chronic insomnia. So the recent treatment shows that cognitive behavioral therapy is one of the most used therapy for sleep disorders. But when CBT does not help, people tend to move to traditional medications such as benzodiazepines and non-benzodiazepines, GABA-A receptor agonists. And it is known that the key gap in sleep disorder treatment is ineffective treatment implementation with the need of extensive evaluation. And so the individuals now, most of them are searching for more cost-effective and efficient therapies. And from what we know from our data, another approach that is also used by people is called alternative medicine, which covers various aspects from diet and exercise to mental conditioning and habit changes. And yoga is one of the preferred therapy because it acts as a stress reliever, helps combat the symptoms of sleep disorders. So that is why we are interested to talk about the role of yoga in overcoming sleep disorders in our student project. So this is the problem formulation in our student project. We're going to talk about the definition, causes, effects, mechanisms, of sleep disorders, definition of yoga, common effects of yoga, how yoga helps overcome sleep disorders, and what are the different yoga techniques to help sleep disorders. This is the writing purpose. This is the writing benefit for scientific development and for the community. Well, that is all from me. Thank you very much for your attention. And the presentation will be continued by my friend. Thank you.
Okay, thank you for the time. Hello, my name is Naomi Margaret Bayar Panjaitan and my last digit of student number is 167. Here I'm going to explain about the definition and types of sleep disorders. Sleep disorders are conditions that are associated with decreased amount and quality of sleep, resulting in difficulty in doing activities during the day. There are several types of sleep disorders, some of which are insomnia, sleep apnea, restless leg syndrome, hypersomnolence, and narcolepsy. The first one is insomnia. Insomnia is one of the most common sleep disorder. This condition is associated with persistent problems in initiating sleep or maintaining sleep. Another type of sleep disorder is sleep apnea. The presence of breathing problems during sleep is typical symptom of sleep apnea. People who have sleep apnea will experience repeated episodes of airway obstruction during sleep. The third type of sleep disorder is restless leg syndrome, an urge to move legs that accompanied by uncomfortable sensation on the leg at the time of going to sleep is the symptom of this syndrome. And then there is hypersomnolence. The typical symptom of hypersomnolence is feeling sleepy even though the patient has slept for at least 7 hours. Turning to narcolepsy, an unbearable need to sleep several times during the same day is the symptom of narcolepsy. Sleepiness usually occurs daily or at least 3 times a week for at least 3 months. Moreover, cataplexy is the typical symptom of narcolepsy. Cataplexy is a sudden loss of muscle tone triggered by laughter or jokes. Usually, patient is conscious during cataplexy. That's all for me. The next slide will be explained by my friends. Thank you.
Hello everyone, my name is Stefanus Centuria with last 3 digits to number is 150. So now I'll explain about the etiology of sleep disorder. The first one is insomnia. which the etiology is multifactorial because it involves genetic, environmental, psychiatric, and cognitive aspects that contributed to the hyperarousal conditions. The second one is sleep disorder breathing. The etiology of sleep disorder breathing, which leads to compromised ventilatory and resistive loads, range from breathing control to mechanisms of upper airway and thoracic wall. The third one is central disorder of hypersomnolence, which usually develop when abnormalities are found in the part of CNS that regulates the sleep-wake mechanism. In addition, drug consumption, medical conditions, psychiatric and sleep deprivation can also be involved in the development of hypersomnolence. The fourth one is circadian rhythm sleep-wake disorders, which the underlying cause can be divided into two main categories, namely alteration of the circadian rhythm by the external environment and the mismatch between the environment with the circadian rhythm system. The fifth one is parasomnias. The etiology of parasomnia is the result of the interaction between intrinsic and extrinsic factors. Non-rapid eye movement related parasomnias is thought to be associated with the disturbance in slow wave sleep stage 3. On the other hand, neurodegenerative and psychiatric conditions are thought to be contribute to the development of rapid eye movement related parasomnias. The sixth one is sleep related movement disorder. Disorder of motor control, such as excitement and inhibition, are frequently linked to the sleep disturbance and can cause abnormal movement while sleep. For instance, the cause of restless leg syndrome may be predominantly inherited, hereditary, or secondary to the iron deficiency. That's all from me. Thank you.
Hello everyone, my name is Dewi Bintang Matasari with the student number of 2002511211. So today I would like to explain about the effects and symptoms of sleep disorders. So the first one is the effects. The effects of sleep disorder are affecting not only the patient but also the family, co-workers, and society. It can cause serious threat in society such as sleep-related car accidents and industrial disasters due to tiredness. Irregular sleep can cause low performance because of daytime sleepiness. Irregular breathing during sleep may risk of hypertension, heart failure, and stroke. In the US, sleep disorders cost $16 billion directly, while indirect costs are more than $100 billion.
Hello, my name is Amanda Raisa Surananda with a student number of 2002511237. So, continuing my friend's presentation with the symptoms of sleep disorders, the cardinal signs is trouble getting asleep or staying asleep, poor sleep quality, and excessive daytime sleepiness. The risk factors related to symptoms are age, inactivity, anxiety, education, and BMI. Symptoms may also arise from underlying disease, such as in blind person. This is a table that contains symptoms based on the type of sleep disorders. This is also the same table. So that's all from me. The next presentation will be continued by my friend. Thank you.
Hello everyone, my name is Angelina Virtamulia with last three-digit number 051. So next I'll explain about the mechanism of sleep disorders. First is about insomnia. Insomnia happens due to physiological hyperarousal. It can happen because of psychological stress or maybe a side effect of any disease or both. The mechanism of insomnia is associated with some domains such as emotional, physical, and social. Next is circadian rhythm disorder. It happens due to misalignment between endogenous biological rhythm and environmental light cycle. In relation to sleepiness and wakefulness, the sleep-wake cycle is endogenously either accelerated or delayed, while exogenously, the circadian rhythm disorder occurs as a result of mismatch between biological rhythm and intended sleep or wake schedule. Next is obstructive sleep apnea. It happens due to inability of upper respiratory dilating muscles to hold the negative force that produced during inspiration. The upper airway obstruction predisposed by unable of coordination between the time of each inspiration and contraction of upper respiratory muscles to withstand the negative pressure. Maybe that's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Madi Kirana Chandra Heruputri with my student ID number is 200251168 and I'm going to continue the presentations. So another mechanism of sleep disorders is non-rapid eye movement sleep parasomnia, which is the result of impaired arousal that is characterized by autonomic nervous system activations, abnormal nocturnal behaviors, and also impaired consciousness. Another one is rapid eye movement sleep behavior disorders. It is characterized by vivid and often frightening dreams that are accompanied by simplex or complex motor behaviors. The polysomnographic and neurophysiological hallmarks of RBD is REM sleep without atonia or persistent muscle tone during REM sleep. Another one is restless leg syndrome. So restless leg syndrome is caused by genetic and also environmental background. Some mechanisms that play a major role in RLS, for example, hypoadenosynergic and hyperglutantergic state cause the activation of the arousal system and resulting in hyperarousals, while genes, hyperdopaminergic states and also hyperglutamatergic states cause the dysfunctions of corticostriatal thalamic cortical circuits that resulting in periodic leg movement in sleep akathisia. That's all from me. Thank you.
Good morning, Dr. and friends. My name is Putri Audrina Astustiawan with last digit student ID number 097. Now I will continue to the next chapter about chapter 2.2 about yoga. The definition of yoga. Yoga sometimes called as a meditative movement practice, which at first is used as spiritual practice, but now become popular for mental and physical well-being. And there are various types of yoga, such as Ashtanga yoga, Kundalini yoga, and etc. Each type has its own distinct focus on the relative content of physical exercise and posture or asanas, breathing technique or pranayama, relaxation, and meditation or dhyana. In palliative care, yoga will help in improvement in sleep quality, management of physical symptoms, mood and stress management, enhance mind and body, spirit connections, and increasing the quality of life. The next part will be continued by my friend. Thank you.
Hello, my name is Jason Emery. My last three digits of student ID is 081. And today I'm going to present about the common effects of yoga. So here are the common effects of yoga. It can lower your blood sugar, ease musculoskeletal problems, maintain the cardiovascular system, boost mental vigor, and it can also lower your aggressive, depressive, and anxious feeling. And the rest is it can improve your sleep quality. This is all from me. Thank you.
My name is Putu Ardisa Pradeswari with student ID number 200211172. And from now I will explain about how yoga helps overcome sleep disorders. For insomnia itself, is one of the most common sleep complaint. It can be acute, lasting 1 to several nights, or chronic, even months to years. Yoga exercises that are applied to insomnia cases result in significant change to insomnia problems. Yoga exercise movement is have an element of coordination which creates cooperation between the central nervous system and the muscle in certain forms of movement. This exercise can involve both large and small muscles, but very little involves important organs such as the heart and lungs. Stimulation production of cortisol due to tension and psychological burden will damage the walls of blood vessels, which will also disrupt blood flow to the brain. The increased production of this stress hormone stimulates the work of neurotransmitters, nerve messengers in the brain relate to the emotions, due to stimulate dopamine. By practicing yoga, as awareness increases, the turbulent mind will be stilled. Yoga is one of the methods for calming a restless mind.
My name is Vivian Scala with 3-digit number 169, and I'm going to explain about the different yoga techniques for sleeping disorders. The first one is Kundalini Yoga, which is a safe practice that focuses on meditation, breathing, relaxation, and also postures. Most of the exercise performed in a sitting position with the spine erect, breathing through the nose while the eyes are closed. Other types of yoga also provide positive benefits for sleeping, like Vinyasa yoga and hot yoga are suitable for those who prefers a higher intensity of workout performs hours before bedtime. But for those who prefers to do yoga closer to their sleeping schedule, could do hatha yoga, which have much gentler poses and breathing techniques, or nidra yoga, which is performed in a supine position. Nidra yoga emphasizes the perception of certain parts of the body. That's all for me. Thank you.
Okay, my name is Ananda Karaharja with last three digit of student ID number is 136, and I will continue to the chapter 3. Okay, for the conclusion, sleep is a natural state of the human mind and body, which is characterized by a reduced state of consciousness, and sleep disorder are a condition of functional disturbance involving inequality, timing, and amount of sleep. Yoga or meditative movement practice is a popular spiritual practice that now also promotes mental and physical well-being, and various studies have shown that yoga has beneficial effects on the body. Yoga has been shown to significantly help patients with insomnia problems by relieve stress and reduce the mind-body activity. Which yoga technique can be help patients with chronic insomnia disorder, including Kundalini yoga, Vinyasa and hot yoga, Hatha yoga, and Nidra yoga. For the suggestion, in recent periods, yoga has become popular all over the world with its various health benefits, and further explanation is needed to explore the benefits of yoga, not only on a physical aspect, but also on a psychological, social, and spiritual aspect. And the authors also recommend further research to discover various yoga techniques to find the most effective and beneficial yoga techniques for human health. And this is our bibliography. Okay, maybe that's all from SGD B5. Thank you for listening and have a nice day. Thank you.